bet. All righty. And for the interdisciplinary admission process session today, it is being recorded by Jody. And with that in mind, we do have a recording disclaimer. Content recorded with point-click care is valid only as of the date the recording is made, and today is June 4th, 2024. Information or instructions about any given topic may subsequently change. Content may include protected health information. All content should be treated as private and confidential. Recordings are managed by the requester, and point-click care recommends that files be stored in a secure location. So with that having been said, we'll continue to move forward. And just as a reminder, we have opened the resource hub and gone into news and updates. So hopefully that's something that you've used before. And if it's not, please definitely you're going to want to start using it moving forward. Okay. Now, another question that sometimes comes up is we can't put PHI here on the facility bulletin board. However, we can put it in what we call the communications portal. When I select the clinical menu option underneath the care management column, you'll notice that I have one that says communications. As I enter that, any communications about a resident can go here. When I select new, I open up an area that looks very similar to the facility bulletin board. One of the differences is that it does have a field for you to put in a resident's name. Once you've done that, you make sure that the date and time doesn't display when it's no longer relevant. So if I put something in here, let's see, maybe he is being picked up by his son, Jack, at 1 p.m. for a drive, plans to be back before dinner. Now, as we're looking at that, this message would be great information for my caregivers and my nurses. And the information that is on not only this area, the communications portal, but also the facility bulletin board. These items are visible in point of care as well. So you will be able to, unless you've disabled that, the aides would be able to see these messages there. The messages that are in the communications portal, although they can contain PHI, it is not something that goes into the person's medical record. This is simply an internal communication. Some people use this for adverse events that could happen at a facility to alert everybody to some type of alert charting, perhaps, or any other kind of messages you wanted to get across. But again, that were simply internal messages. Once you're done here, make sure the date as to when it won't display after is included. And a lot of times I also will even put the date in here just to make sure nobody is confused about it. Once you're done, select save, and your message is now available to the nurses that log in, as well as in point of care. This area also has the shift reports as well as summary reports that someone might want to download or look at before the shift begins for the day. Any questions about anything that we've touched on so far? All righty, fantastic. So what I would like to just briefly discuss as we start going through is in an organization with multiple facilities, I do want to make sure that you guys are aware of utilizing the functionality of search when adding a resident. So with that in mind, under clinical, which oftentimes will be the department, nursing, that might add a person when they first arrive in the building. It is possible that that person has already been added, but not added in the census yet. As I come in here, I can select Quick ADT, stands for Admission, Discharge, Transfer. As I select that, what has opened up is me searching the entire database for a person with the name characters I'm going to put in here. So for surname, I'll put in a few characters. For first name, I'll put in a few characters. One of the reasons that we do that is to make sure that this person has not lived or is not already entered in the database somewhere. If they've been at another community within your organization, you will find this person already exists. There is one enterprise ID for a person. Now, of course, when they go into an individual facility, they're going to have a medical record number for that building and so forth. But as far as them, there is always one enterprise ID, and that also does enable sharing of some data between communities within your organization, which makes the whole process of admitting someone just a little bit easier. Okay, this is what the search looks like. When I type in just a few characters, because the less characters you have, the more results you're likely to bring in, and I click on search. If the person is found, they will be listed down here and their name will be in blue. When you see that blue, that is a link. And when you click on a resident's name for a link, you typically are going to go into their chart. Now, as we look over here to the right, you're going to notice that this person has already been entered in this particular training database. So in some cases, it's possible that you might see here another community within your organization. You're still going to admit them to your facility. You're just going to be able to share some information electronically between your building and wherever they previously resided. Next step, I'm going to go ahead as the nurse admitting this person, select the name. Once I do that, it now has taken me out of the search and put me into the census entry. All census entries are typically a two-step process. Up at the top here for clinical, once the person has indeed arrived at your building, you're going to select active admit. You'll have the date, and please do make sure that the time is consistent with the time that the person arrived. Below that, in the next section, where are they going to live and where did they come from? So location, this brings to us the first of some icons you will see throughout the software. The magnifying glass icon, that is a lookup tool. It's going to provide you with a list of something that you can choose from. So when you hear me say, click the lookup tool, you'll know that that's the magnifying glass. The red asterisk that's at the end to the right of the word clear, that indicates a field is required to finish that page. So those are two of multiple icons we're going to talk about as we go through the system. Do try to make note of those, or try to be sure you know what those mean. You'll be seeing them over and over again. I'm going to use my lookup tool for the room this person is going to live in. Select it. The next field has a new icon, dark gray circle with an eye. When I click on it, it opens up information about that particular field. With saying that, the field says to and from type. So in this case, the person is coming from somewhere because they're admitting to our building. So I simply use the drop-down box and select the type of place they're coming from. Once you choose the type of place, you go to the next field and name what that place is called. Okay. Other information below that, in this case, is already populated. This could be because the person was, before admission, had a chart opened by my admissions coordinator or marketing team or director of nursing, something like that. Any information gathered before the person physically comes to your building, most of it can still be entered, and the person can be on what we call a waiting list, meaning we expect them to come. We want the chart open so that we're not re-putting in information that we already have, but they aren't in the building yet. So this is what initiates them in your building. Simply selecting save. And it looks like I did not include a required field. So if you'll recall, all of the required fields have a red asterisk. And so that's the messaging you're going to get if you miss any of those required fields. This on the right-hand side, it does not have a red asterisk. So I don't necessarily have to populate that. I'm going to go ahead with save. Providing you haven't missed anything here, all you have to do is wait for that to save, that information to populate in. Where you will find anybody who is already admitted to your building is going to be a couple of places. To start out with, when we select the clinical menu, you'll notice that there's quite a bit of information there. You may or may not see every single thing on your screen that you see on mine. Everything that we go over, however, if it's something that you would do in your role at your community, we do want to make sure that you are able to see that. So when I do go to the list of residents, across the top, you'll notice we have different statuses of residents. So as far as current goes, which is where you'll land by default, that is going to be people who have had a census entry of active admin. They live in my building. It is also possible you could find people on the waiting list. This are going to be any people that we think are coming to the building, but they have not actually arrived yet. They've opened a chart for them, but not everything's populated. And some of the others, they'll reflect things as well. In all of these, you'll notice when you get there, you have the alphabet across the top so that you can go to the first letter of the last name and make it a little bit easier to find somebody in this list. Another way I like to use when I'm going to somebody's chart, upper right corner here, utilizing this search field. The search field stays up here, and it does make it a little bit easier for me to get to a person. It's certainly less clicks. If I put in a few characters of either the first or last name and hit search, it will bring me into that person's chart. So wherever you're at. Now, if I had more than one person in the database with those 4 characters in their name, it would pull all of them up and you could choose the one that you wanted by clicking on their name. Any questions on that piece of admitting someone to the building before we move forward?
I have a question. So that was
Please.
a person you were actually admitting.
Yes,
Where is the
ma'am.
waiting list for that person?
Okay. So if you guys are going to use the waiting list, let me show you something just a little bit different. Now, what we just did there is likely what your clinical staff on the floor would do. That's probably about where they would come into the process. Now, if I am, let's say, with admissions or marketing or something like that, and I just want to get a chart opened, I can come in here, and best place for them to go is going to be new resident. The reason for that is once they search for the person, they're going to go straight to demographics page, and the demographics page is where the check mark for waiting list is located. So let me do this in 2 stages. I'm going to open Mr. Malone's demographic page, and I can get to it underneath the edit button in the drop-down box. If I go down 3 of the sections here, or the 3rd, you'll find a place where waiting list is listed. Okay, now let's go to entering a new resident, and you still have to go through the process of searching for this person. So no matter which way you're doing it, we don't want duplicates. So if I'm going to search for a new person I'm entering, I put in a few characters of the first name, a few of the last, same as what you saw. And if this person has not been in our community or our organization as a whole, you're going to get a message that looks like this. So this is a little bit more that pre-admission type of stuff. And I'm going to go ahead and click continue. What that does is brings up a blank demographic page where I can go in and continue to populate the person's information. So a couple of things about this is it will be important someone has accountability for ensuring that at least the blue fields located here are all populated. So whoever that is at your building, someone will need to be accountable for making sure that happens. All of that information is getting pulled to your MDS. Now, in the field here at the top, as a general rule, people in production or live databases, this number generates automatically. It just isn't set up that way in the training database. Also, want to be sure that if someone has a prefix to their name or a suffix, that those go into the correct field, not into the surname field or first name. Middle name also should go to the middle name field. Now, no matter what the person wants to be called, we want their legal name in these fields. You have preferred name here if they go by something different. It could be their middle name, it could be something that doesn't have anything to do with their name. But the bottom line is it will come in here. Continuing to populate information collected. For example, you probably already know the birth date before they come, especially if they're coming from the hospital. You're likely reading through discharge paperwork, or it's possible somebody's even gone over and visited with them. But the waiting list itself is simply placing a check mark in the third section. You can also here enter the date that this was requested and the date we expect they're going to move in. At the bottom, you can select Save. Again, populating here any information that you already have. Once you do that, you'll notice that I now have gone into Mr. Stone's chart. And as a person who has knowledge about some of the information, I could start populating some of that. I could put in allergies, immunizations, diagnosis if they exist. Of course, that demographics page. One thing you cannot do when a person is not in the building yet, they are pre-admit to the building, and that is they don't have a room number yet, which is what will show up under location. And what that means is putting in a photograph of them. If wanting to do it via our app, that's called Chart Pick, that can be downloaded from the App Store or the Play Store. You would log in using your Point-Click-Care credentials. This person would not be there until the census entry, meaning they've come into my building and are active in my census. They wouldn't be there for you to add that photo. But of course, you're probably waiting till they come anyway. So that is a little bit about how that waiting list works. If I were to go back to the list here where it says residents, and
Excuse me.
yes,
What was the app again that we would need to add the photo?
Chart Pick. The last word is PIC, like picture, but it's shortened just to pick.
And we have all the pictures on there already, right?
We do.
Then you won't have to worry about it except for admissions moving forward. So it sounds like if you already have them, somebody may already know how to do that. So coming back to the clinical resident list, I have myself filtered by the letter M, and that's why I only see Mr. Malone. As I click on all, it takes me back to everything, and I'm looking at current right now. When I go to S for Stone, not here because we have not made a census entry, will be located on the waiting list. Now, from the waiting list itself, a person could also click the quick ADT from here, or more likely your nurses are going to use under actions, quick ADT, and they're going to search for this person by putting in a few characters of the last name, a few characters of the first name, and searching. Just like we did with Mr. Maverick Malone, we now have done or could do the same thing for Johnstone. All righty. Any questions about anything there? Fantastic. All righty. We are actually going to go back to Mr. Malone's chart. Again, there definitely are going to be things that that some of you folks have probably already done. And there may be some people who haven't seen some of these things, but do know that once you set a filter in your resident list, it's going to stay there until you change it. So in order to get to current residents and all current residents, I would need to reset this. Or I can always go to the resident list and I can go to Mr. Malone's chart that way as well. This just happens to be a few less clicks. When you come to a person's chart, you will have a tab called Profile. This is information that could be populated before they come to the building. So there may or may not be information here for the clinical staff or anybody else. However, there also is a possibility that there could be more contacts on the day they arrived at the building than what was entered pre-admit. You have an add button. You simply type in the person's name, first and last, phone numbers, if you have phone numbers for them. And by putting all of those in, you can also put a sequence to them, indicating the order they want to be called in the event of an emergency. Okay. Now we can put in their address if we have it. We probably would want to put in their relationship to the resident. In this case, I'm going to make it Mr. Malone's son. And although all of these relationships are listed alphabetically, I can filter through the list by simply typing in the word son. It will take me right down to where I need to be. If I put in the wrong one, I just change it. The other thing that you're going to want to populate about this person is their role in the life of Mr. Malone. So depending upon Mr. Malone himself, it's possible that maybe all they are is an emergency contact, maybe a next of kin, something like that. Or there could be they are the power of attorney. It could be that they are, if he didn't have family or something, it could be maybe a guardian, a state guardian or something like that. The bottom line is I want you to choose here everything that you know is for this resident. So you can choose as many or few of these that apply. Clinically, the one I would want the day of admit for sure is emergency contact number 1. And that's because if they come in late Friday and something happens Friday night, I want to know who to call if I'm the night nurse. So that's just my thinking on that. Certainly something you guys could take into consideration. Once you've chosen whatever applies, you simply select save. And if there are more people, save anew. If that's it, simply save. And again, I would think pre-admission, we probably have some kind of contact listed because they're probably making sure there's a payer source. Now, the next field here is the medical professionals associated with Mr. Malone. When I click on modify, it is going to bring up a list of a variety of medical professionals. This list is located in the financial side of this particular database and is trained on by the financial trainer. New doctors are going to come along, and so it will definitely behoove you that somebody does indeed know how to manage this list and others. You can filter it by the type of doctor or prescriber. For example, if I had a nurse practitioner, or maybe this person has a specific dentist that they see. Anybody who might write an order, it is going to be important we get their name here. Now, one that has to be here, primary physician. So I'm going to filter by that, hit search. Every doctor that I see now here is listed under profession as primary. When I select the box that says primary, it checks primary and include. You can only have one primary. So if I tried to select a different person, it will eliminate primary for the first. Not saying you can't have more than one doctor. You can have as many as you want. However, only one of them can be the primary. Once you do enter that and select save, the first time you get a message telling you that you are changing the primary or attending physician. And the reason you're getting that message is because, well, there wasn't one in there at all, but more so because down the road, if this person did change prescribers, attending physicians, primary, any of that, you're going to impact the billing. So that's why it's giving you this message. For us, it's the first time they've had one entered, and so we're simply going to click save. Your primary or default options will always be bold. So now we'll notice our primary, the one at least that's primary to this resident, is in bold. And that also populates the name in the header of the chart, which is this entire area at the top of the page. Okay. Custom information. If you were to click on edit all, you could see all the variety of things that could be populated. Typically, these are going to be items that are not populated anywhere else in the database. Remembering that the red asterisks are indeed required fields. You would see any of those, they would be required. If not, then they are not. It will be more of what your policy is. External facilities, again, this is a list that is managed under the admin side of the house and set up, just like your medical professional list. But under external facilities, you likely will see by default your pharmacy that you are going to be integrated with. Now, the integration is good, and that training is going to be done by a different person for you. But if for any reason this person had some specialty medication that Omnicare could not provide, you can add an additional external facility. It could be another pharmacy, like if I was looking for a pharmacy, maybe Omnicare didn't do compound medications, something like that. I could go to the list and filter it just like we did for medical professional. I do want to point out to you across the top here, we only see Omnicare because we are only looking at a hot list or an abbreviated version of the full list of pharmacies available to choose from. So if you were to fill in the other radio dial, more would come up. And so with that in mind, if there was another one on here that you needed to add because sometimes you get something from them, you can simply check mark it. You also can add any additional areas here that the person might have some kind of affiliation with. If they came from another nursing home, if they came from maybe assisted living, if they have perhaps a prepaid funeral arrangements. Maybe I want to have list what the name of that funeral home is. I can move topic to topic, leaving it at all facilities to pull in everything I want. And when I'm done, I can click save, and everything I chose will now be populated. You'll notice that for pharmacy, Omnicare is indicated as the primary, and you're going to want to leave that way because that'll be the pharmacy with the integration. And so if we pick a second pharmacy, it does have make primary, but if you do not have an integration with that pharmacy, then you would not want that. Okay. A few things here on the profile tab. Questions from anyone on anything here? All right, fantastic. Some other areas that I'd like to go with this is I want to touch on this care profile at the top of the page. So when I click this in the header, remembering that everything up here above this kind of darker gray line or above the tabs of the chart is considered the header. You'll hear me use that term quite often. When I select care profile, I have the ability to come in here and of course mark things that maybe the resident has come with. Glasses, maybe a hearing aid, perhaps dentures, and then it will want to know, are they full or partial? Some people might bring their own walker or wheelchair. Some people may have prosthetic limb or eye. Some folks, maybe they have come in with, if they came from the acute, they might have come over with a catheter that the acute put in. And if it wasn't chronic, we would select new. As you scroll through, some people, if they might come with oxygen and maybe it's already set and chronic, choose here whatever applies. The information here can push to some of your assessments. So, a time-saving tool. At the very top of this page, you have a free text field called Special Instructions. Whatever you type in here is going to show up in point of care along with EMAR. Because the header shows up in point of care and in EMAR. I'm going to go ahead and select save. And once I refresh my page here, you'll notice that at the top, I have those special instructions that came in. Now, moving forward and maybe a little bit to the side, another way that you can get photos of new people in here is by uploading it from a computer. So if you use maybe a digital camera or something rather than the ChartPic app, all you have to do is click on photo and go to that location on your computer where you store all of those pictures and choose the person's photo. Click open like you would if you were attaching an email, and then import. And once you've got the picture up there, you can just close. So there are two ways to get pictures in there for folks. Okay. Now, the next tab I'm going to touch on is diagnoses. When I select medical diagnosis, and this is going to be continuing as we move through, when I want something new in here, I simply select new diagnosis. In some cases, it is certainly possible that our person who did some of that pre-admit work may have also put in some diagnoses. They also may or may not be having a skill set of sequencing them or putting them in an order. And that's really okay. Getting them in here simply is saving time on the day they arrive. Diagnoses can be entered in a couple of ways. In the ICD-10 field there, we can type in the ICD-10 code if we have it. When I type the code in and click on my search icon, I notice that I have pulled up a hot list. Notice that that's what's in blue for I63.9, and I'm getting no answers. If that happens, select all diagnoses, and if they find I63.9 there, it will populate for you. Remembering that the red asterisks are required, you will want them to put something in there, save and new, if there's more diagnoses to add. As I go through, and if I do have the handy ICD-10 codes already, all I have to do is start entering them. If I do not, if I need to go with a description instead, you have a search field here as well. So if I type in the abbreviation for chronic obstructive pulmonary disease, COPD, some of these common abbreviations are something you can use. Select my search icon. It will pull up some of the ICD-10 codes related to this, and depending upon what the doctor identified this as, we go ahead and select that particular one, put it into a rank, and then save and new. The ranking cannot overlap. If it does overlap, you will get a message telling you that. For example, I have a message saying I can't use A because the primary diagnosis, A and B, as far as ranking goes, those three are taken. So now I know that I need to move this to C. And again, continuing to move through until you get all of your ICD-10 codes, at least the ones you know of right now, into the database. Don't forget, when you go to lists and you find no records, look up to see if the list has additional views. You are going to find this in multiple places, not just here. Okay. Questions on entering the diagnoses?
Jenny, I'm assuming that's something you do because of the ranking?
Yeah, myself and Mary Ellen do this part.
Okay. And then if there was a new diagnosis that the nurses wanted to put in, how could they do
No.
that without affecting your ranking?
They don't put it in. Whenever there's a new diagnosis, they let Mary Ellen know and Mary Ellen puts it in.
Okay, perfect. Thank you.
You're welcome.
Excellent. Good process call out. Also want to just call out the diagnosis sheet in that this is something that is created if you're utilizing the billing out of point click care. We definitely would want to be certain that we create a diagnosis sheet because this tells the system what order to put in the diagnoses on your UB04 or your bill. And so that is one of the reasons that it is quite critical to create. You'll also notice that you can create individually the therapy as well as the primary. Identifying a diagnosis as therapy is done initially when we're entering it. And when you're done, you can just click save after you put in the date that these are effective. And it will create a primary and therapy if we had therapy diagnoses yet. If not, we simply select save. You'll notice the diagnosis sheet populates at the bottom. Okay. Now, something else I want to make sure you are aware of, and you very well may be, but it's called Master Patient Index. That is MPI, and it is managed or turned on from the organizational level for the facilities. What that does is you see these little filing cabinets in my little red square there on the right side of my page. You'll see that icon. That's the filing cabinet. What that does is it looks up Mr. Malone's information if he happened to have been in another one of our communities. What it then is going to do is provide us with a diagnosis history, which will populate at the bottom. As I click on that, it adds the field of, I'm sorry, not at the bottom, but at the top, new field of medical diagnosis history. So if he had been in another facility with diagnoses there, they would be listed here. The filing cabinet appears on some of the pages, not all of them. And the way the information comes through is different for each one. In some cases, the information can simply be auto-populated into your database. For example, demographic information. Medical diagnosis, another example of a different way. Here, what it would do is simply give you a list of any ICD-10 codes that existed at another building, and then you could choose to add them by clicking on New Diagnosis and adding in the ICD-10 code. So the functionality is a little bit different as far as how much information populates, whether it is read only, whether it is us, we can see it, but we manually have to put it in there, or whether it just automatically flows. All right, so just a few things there, just some tips to be aware of. Another item you'll find repeats is going to be these reports on the far right-hand side. You're going to find this tab on most of the tabs, and of course, it's a report for the individual. Anytime you see the word audit there, audit is going to indicate who did what and when. And you'll see audit reports for most all of the data entry. Another item to be very aware of is the display filters. Most pages already have display filters put in. And so if you're not seeing something you think you should, please open it and adjust as needed. This does not stand out, and so in some cases, it can certainly be helpful to be aware that's there. Our next item is allergies. When we come here, a lot of things are very similar in function to what you just saw. One thing we have on the right over here I'd like to point out are a couple of information icons, the dark gray circle with an eye. So whatever they're next to is what they're giving you information about. So I happen to be next to the report tab. And when I click on the information icon, it tells you about the audit report. If I click on the information icon that happens to be on the display filter row, you'll notice that it's giving you information about the date of allergies. When you do click new, most of the time you probably don't know when somebody's allergy really began. And most people are going to leave the date as the date of the admission. However, you also have unknown if that's the route you wish to go. You have to select the category first, and the only category that we compare against all orders entered is the drug category. So if I select the drug category, what the system is going to do is look for allergens in this Medispan library. So if this person had an allergy, let's say to penicillin, as I start typing it in, it's going to bring up options for me. Predictive text. Select what you need. Be sure to populate at least the allergy type. If you want to put severity as well as what that reaction looks like, you certainly can do that. Simply selecting. I do want to point out to you that as a reminder, some only show up as an allergy if we're using the drug category. So if my person had a peanut allergy, let's say, and it was very severe, maybe they even have had instances of an anaphylactic reaction. I'm putting that in there under food because peanuts are food, but I might also put it in under drug if peanuts are in drug as well. This message is telling you what I had just said. The only clinical check for allergies related to medications, it's going to compare to allergies in the drug category. This is not the drug category, and that's what it's telling you. So in some cases, certainly in the case of a very severe allergy, it might happen to be helpful if you put it in both places. So there are medications that have peanut containing ingredients or products. So putting it here and being sure that we put in that reaction can be helpful. And one of the reasons I put that there twice is, one, I'm putting it in under drug because I want to make sure we're checking against medications that could have peanut containing things. Eggs is another good example of that. Red dye is another one. I don't necessarily know what medications or what all medications might have those food containing. So if it's something severe like this, I'd put that in. I also put it in under food in case my dietary professional might run allergy reports by the food category. And if indeed they do that, they would not catch it if you didn't put it in the food category. So just some FYIs or things to think about. If anything here is in error, update will not let you remove something because of an error. What it does give you is the ability to resolve it, change its severity or manifestation, or add a new note. That's what update does. If something was in error, that is where we select strike out. Once I click on that, I've opened up what I want to strike out, and at the bottom, I need to click strike out, put in why I'm going to strike this out, and then select strike out. That process is going to happen in multiple places in Point Click Care. Okay. You'll notice it appears to be gone, and that's because there are display filters in effect, meaning we're only looking at active. If I wanted to see struck out, resolve, prior history, or anything else, add it and hit search. And you'll notice that the penicillin is now back and it has a line through it. That line is because it's been struck out. And if you look on the far right-hand side under status, you'll notice that that's what it says. Okay. Any questions on entering anything here? All right, fantastic. The next section we'll touch on briefly is immunizations. So, of course, here, and again, this should look very familiar because you've got your new button, you've got reports on the right-hand side, you have an information icon over there, and in some of the tabs, you've got the filing cabinet. So all of this should look very familiar, and their function or operation is also going to be consistent. The display filters, make sure that's, if you're here trying to find something and can't, you always want to check those display filters. To add an immunization, you select new. Now, in a lot of cases, especially if it was somebody that maybe is coming to our building in June, they probably had their maybe their influenza vaccine maybe last fall for this particular season. If that is something you wanted to document, was that the last time they had it was in October of 2023, you simply select the immunization name, and then choose for the given field historical, and then you can go to the date field. You can change the year, you can change the month, and put in the date it was given. If you're going to put in more than one, save in new. Anything documented here does not interact with your EMAR at all. This is intended to be a collection of information for your infection prevention program where you're keeping track of what's been done and when. Okay. Now, if you do a TB test when someone comes to your building, you could also select that. So hypothetically, let's say you do a 2-step. When I select that, I now have a new field here because this is step 1. The first thing I have to do is document that I got consent. When I select consented, my name and the date are going to populate in the next 2 fields. I'm saying I got consent. If I provided additional education to the family or the resident, I can place a check mark here. Or if someone else did, I also can place a check mark there, and I could put in their name. So, few different things. Date and time that the injection was given. So if it's today and perhaps earlier, when you arrived, something to that effect. You can put it in. Route, of course, that one's going to be pretty standard. Amount will also stay standard along with some of the other fields, but location given, if you don't have a consistent one, then you'll choose which forearm. The manufacturer, expiration, and lot number would all be on the bottle. And the person who administers it, when I select the lookup icon or the search icon, it should pull up people for me that have in their profile the ability to give an injection, for example, a nurse or a doctor. The next few fields, of course, we don't populate yet because we don't know the results. This would be something you would come back to and populate in a couple of days. Also, in a couple of days, when you come back, you first update your result to hopefully negative with no induration. So you can come back, update, enter the results and induration. And when you're ready to start step 2, you do that from here, not from the new. New is for the initial entry of the TB shot, if you're doing the 2-step. Any questions there?
I have a question. It may not be specifically to this exact thing, but I was wondering if there's a way to bulk put in immunizations. Like, so for everybody that has had their COVID, their first shot, like, can we just do that by checking off multiple patients' names at once, or do we have to do it individually?
Very good question. We'll go there right now and let me show you how that's done. So I'm sorry, yes is your answer. You can do that. Let me show you real quick how. So we have a quick entry area. And if you were to go up to clinical as far as the menu option, the third column says quick entry, and there's a section that says immunizations. When I select that, what it's giving me the ability to do is choose the type. So if it were a booster or something, I'm going to just leave it set to flu and kind of imagine that you guys likely do some kind of little flu clinic maybe in the fall where everybody who consents gets their injections. So I can select that. I could filter the resident names listed below by unit if that's helpful. Okay, or I could leave it set to everybody. You can, the date range here is we're looking at filtering people that are in our building. So if I was doing this last fall or for fall, that would be the date range. The consent confirmed by field here has my name and today's date, which of course would be last fall or this fall. And this is the first section. Before we go to the second piece over on the right-hand side of documenting administration, the first thing we need to do is document we got consent. So with that having been said, if indeed I went down this list and everybody had given me consent, I can go ahead and choose select all and go ahead and save that information. If there were just a few people in my building that did not give consent, I would still select all, and then I would go back and uncheck because it's just a little easier. Now that's if you have a long list of people. So I can uncheck those people who did not consent. Once that's done, I've got everybody marked. I've got consent was gotten by me and this particular date. You can additionally add education. select save, and now in everybody's chart where I marked the consent, that's in all of their charts, okay? It's a real quick way to do it. Now on the right, let's say we're on the day we're going to give the immunization. We can put in up at the top here the person doing it. The route will be the same for everybody. The amount would be the same for anybody. Manufacturer, expiration, and lot will be the same, at least per bottle. So if you're using a multi-dose bottle, so this could depend on what you're using here, but those also do not have the red asterisks, but certainly would be best practice to populate. And you'll notice on the right-hand side over here, we have body location. So if I do them all in the same muscle, I can simply scroll down, adding those. So let's say, you know, we can hit select all. We could uncheck anybody that we didn't do, but we could, if we did do a multi-resident bottle or a multi-dose bottle, we could remove that, and we could just check the people that we used that specific bottle on, so that we had the correct expiration date and lot number. I mean, your manufacturer would probably be the same, but it's possible it's not. Anyway, but this is the bulk you're talking about, where I go ahead and I mark save, and all of that information now for, let's see, Darnell. I'm just going to go to his chart to show you real quick, but everything that you see here, which we did as a bulk, is also populated in the person's immunization tab of their chart. So I'll pop over to his chart with Darnell. And in immunizations, here's the flu vaccine that I documented in that quick entry.
Perfect, thank you.
Yes, ma'am, absolutely. All right, fantastic. The next item that I want to touch on today is one item in orders, not a pharmacy order. So I do want to point out, and actually I'm going to go back to Mr. Malone's chart. I want to point out that the allergies are in the header and they show up in red. I've got those special instructions, if any, that I added in the care profile showing up in the header. One other thing that I can have show up here that is probably something you would want to show up here, code status. So providing you have an order template for the various statuses, you could search for that. I could start by putting in any characters that would be included in the order, like a DNR or ADV for advanced. Sometimes people type in code. Any of those are going to pull up all of these options as templates. An order template, if you don't already know, an order template is a pre-configured order. When I choose it, and this is the only way to get the code status to show up in the header, okay, I can get it into orders, that's fine, but to get it into the header for everyone to be able to see at a glance, I need to put it in this way. Once I choose the order template, You'll notice that a lot of this here is already populated. That's because we created a pre-populated order and put all of those things in there. You will have to put in how you got the order and what prescriber gave you the order. I just temporarily want to point out, there's those views again. Remember, was hot list or all diagnoses? Same thing here. What you're seeing are the ones that are assigned, and assigned means we have entered them as medical professionals in the profile tab. It is always possible you may get an order from a doctor who is not in that. And in those cases, the nurse will need to select all physicians. So beyond the communication method and prescriber, the other field that would need to be filled out, because it does have a red asterisk, is going to be the status. Now, what this is how did you confirm these orders? So depending upon where you're at, you might use some kind of life-sustaining treatment order. And in that case, oftentimes it's written down. You might see it in a DPOA, or maybe somebody in the family tells you. Whatever the case is, we simply select. Once I do this, and if I'm only entering one order, I select Save, acknowledge the order, and sign utilizing my password, and authenticate. Now that particular order is going to populate in the header of the chart. You'll notice it is there now, right between allergies and special instructions. Because you can see this when the nurse is passing medications, if somebody collapsed, cardiac arrest, they can glance at the header and have that information in lieu of having to go into the chart, go to the orders tab and look it up. They can do that too. This is just more efficient. And it also shows up in point of care as well. All right, because the header does. Again, orders, those would be something that you'll work on with your pharmacy integration trainer. Any questions? Hopefully everything is looking pretty familiar to you. Okay. Weights and vitals. Here, when a person admits under add baselines, oftentimes this is where folks will put in those baseline or admission vital signs. So when you put it in, you will have to designate what scale you used for the person when it's related to weight. Under some of the other ones here, it's going to be the position they were in, or it could even be the route that you obtained that particular item. Now, as it relates to pulse, there's an option in here of unable to determine. The reason this is here is if you have CNAs that will do your vitals, if it does not happen to be within their scope, or they are unable to determine whether the rate is regular or not, and they need a nurse to do it, they can select unable to determine. Because that field does have to be populated. So that is just something that's informational. You've got your respirations, blood sugar, if it applies, oxygen saturation, if it applies, what method on the oxygen. I think I gave him 3 liters per minute on a nasal cannula, height, Was he standing? Did I do this wingspan or some other way? And at the very bottom here is where I can put in pain level. Now, on the right-hand side here, there is a section that says thresholds. So some of the numbers that I've put in are likely outside of what we'll call normal for most people. And initially, those are the criteria the system is going to use, a set of default normals. For someone who has chronic pain or is diabetic or has some type of respiratory problem, those in particular fields are likely not going to fall into the same normal as someone who did not have that particular diagnosis. You will notice, and I'm going to go ahead and erase that little box there, and I'm going to change a couple of things here. When I elevate the blood pressure, if I elevated the temperature, pulse, or anything else, I'm going to go ahead and select Save so that those can be listed. For the baselines or admission values, you will notice that we are just getting the information. But when it comes to entering monthly vitals, monthly weights, those kinds of things, or the next time the person gets new vitals, all vital signs will populate here no matter where they're entered. Whether it was in the EMR because maybe I had to check a blood pressure before I gave a medication or a blood sugar. It could be in point of care. You have somebody doing monthly vitals or something like that, and it could be entered there. Wherever it's entered, it's going to live here. And in the upper right corner, you will have the most recent of all of the vital signs listed there. Each one. Now you've got an information icon on the blue row here on the far right. When you click on it, it is going to tell you the norms that Point Click Care is using. Okay, so if I come in and put in some new vitals, let's say we put in or maybe we're doing monthly vitals or something to that effect. In the pain level field, you are given the option to select numerically if the person's capable of that, or the cognitively impaired scale, which is where you are entering observations about them that could then be totaled for a pain score. That would, of course, be for people who can't give you the numerical. And when we go ahead and select Save on those vitals, anything outside of the normals that are listed in Point Click Care in the information icon, those are all going to trigger an alert. So with that in mind, alerts trigger for the staff, your nursing staff or you, on this page, of course. They also will trigger on a clinical dashboard, but most importantly, in my opinion, is going to be the Smart Alert bell in the upper right corner. Couple of reasons I say that, and I drive nurses to watching that bell. And that's because they're not usually sitting on this page to notice the outside of normal vitals. They are not usually sitting on a dashboard where also they might be able to see an alert of something coming here outside of normal. But in the alert bell, where I've got a red dot, meaning there's something there that I have not yet seen, wherever I'm at in the system, even if maybe I was on the resident list, still got the smart bell. What about when I'm in EMAR, passing medications? Still got the smart alert bell. So wanting you to see that, although yes, alerts will trigger other places, that is the place where they're really going to initially see it. When they click on that, you'll find if there are any alerts, they'll come up. If I go into a person's specific chart, hang on one moment, and click on the bell there, you will find that I have two options here. I have the ability to look at everybody who might have an alert or this individual, okay? That right now, Mr. Malone's the only person that has any alerts to be seen. And we'll go into alerts deeper later. The nurses also can filter this field to be their particular unit or floor when they're looking at all of the all of the alerts. So they can choose just their unit, just their floor if it applies. That way they are seeing alerts that are relevant to them and alerts that are real because we would want to put in the norms. So an example, we have oxygen saturation at 89%, which is triggering low. But if this person all the time has an oxygen percentage of maybe 89, 90, kind of that lower end, you could put that into the threshold, and the next time they got something that was normal for the individual, but not for everybody else, then we would not get an alert. And again, you do not want alerts to become white noise, to have it be in the back somewhere of somebody's mind that, oh, that always triggers, and just ignore it and not read it. So do try to make them relevant to the resident as well as the nurse themselves. To close the alert bell, you simply click on it again. Questions on anything there? All righty. It's my understanding you're already doing MDSs in the system, so you probably already know how that works. But if there is any questions about anything there, it would be a great time to ask any questions that you could have. With that, I'm going to go to two areas. The next one I'm going to go to is Evaluations tab. What I want you to know is in the Evaluations tab, when you click on a actual admit, when you enter that census line, it will trigger certain evaluations to populate. And it initiates typically a schedule. So when you start an evaluation, just like with an MDS, you want to open up the next due. this is where they will be started from. If there's a plus sign to the left of next evaluation due, it's because there's more than one there. And when I click on it, you'll notice that a variety of assessments have pulled up. For example, the Braden. So I have a Braden scale and it is due today on admission. So when I click on the name of it, it's giving me the date. It's giving me the current time. I need to make sure it's the same time I'm using. I'm in a different time zone than you are. It says admission. And I'll point out to you that below that, it's telling you that this has a schedule attached to it, which very common. So to open the document, I click Save. Now, as I do that, the document will open. The questions are going to be exactly what they would be if you were doing this on paper, providing you were using our Braden score. Okay, go through, add them. When you're done, we can do a save and exit. We could save, sign, lock, and exit. If there's a possibility of errors, I usually will only select save and exit. And if there were any errors, it would have told me. Also point out to you that if you do not sign it, it will still give you the sign option on the left. Our status remains in progress until we actually lock it. You'll also notice some of these assessments are going to generate for you a progress note. You can view the progress note here, or go ahead and sign with your password that you're the one that did the assessment. And once I lock the assessment, it is creating a progress note, and that is what the message is telling us. It's called a structured progress note. That's what it's creating right now, and that progress note lives in the progress note tab of the chart. No matter where you generate a progress note from, this is where they live. Okay, and the admission persons would continue to go through all of these, completing any of these assessments that are related to them, their job. For example, you could see that there may be social services has one, activities has one. Sometimes information in here will also populate on your MDS. So another, one of those things to just kind of be aware of. You're going to want to schedule evaluations for the next time they're due for anybody who lives in your communities now. And the reason for that is if doing evaluations is new, then you aren't going to have an admission of people who already live there at your building. So I will give you an example. This is the only way to do it. It is very step by step. You may want to take a note if you're a note taker. When you're in this field for a person who's already been living in your community, it's going to be empty. Okay. Evaluations, edit, schedules. When you come here, you're going to select one of the items here that is on a schedule. So an example could be the PHQ 2 to 9. That's something that's probably going to be done every quarter. So the last time it was done, we would look at that date and schedule it for the next time it is due, which will be in the future. Same thing with the Braden, another
Yeah,
one,
I
or
think
Bit.
I think we're doing this a little differently here in our buildings. I talked to Matt about it. Nothing's really going to open up on its own. We are a CMI state, so that means that we do quarterly assessments more than just quarterly. So we can do them every month, you know, depending on what's going on. And if anything is automatically opened, it will turn into a disaster. So everything will be manually opened by myself.
Okay, fantastic. So you won't need to worry about that. Another option or thing to just show you is available in here. However, if you do have assessments or a lot of them that we need to get off or rid of, you can simply come in here. There could be a list. You could hit clear all. It will have a list, and this is a place where you can remove if for any reason assessments get in here and they shouldn't be, you can remove them all at one time. And so that's all. Just showing you this kind of based on you saying that just in case something is activated that shouldn't be. This is a way for you to pull that out.
Thank
Okay.
you. Yes,
bet.
thank you.
We also would want to think, of course, about perhaps the skilled evaluation, the admission assessment that you guys might be deciding to use, those kinds of things. So again, to complete one, if this is blank, you're going to go to new, select, and of course, you're going to have this piece of it done for you, it sounds like. But they're going to come in, they're going to choose it. So if this is done for you, there should be some assessments maybe that are already in here. You click Save to open the assessment and start populating. Moving through, answering the questions. They're pretty straightforward. I don't think you're going to have a lot of difficulty with this. At the bottom of a lot of these sections, you do have a free text box where you could add additional information into this area. Again, scrolling down a little bit, sometimes you're going to see questions that have something to the right of them, in this case, MDS. If we look at that, it is because as I hover over it, it tells me that the answer to this question is going to get pulled into the MDS. So just pointing that out, if indeed this is the admission assessment that you end up deciding to use. And so simply populating is pretty straightforward. Pupils and so forth as we go down. I also want you to notice that in here, you can, as you lock this assessment, you have the ability to activate a care plan. So think, you know, initial care plan. So if I needed to add a care plan in related to vision for some reason, I can choose the focus. If one of these goals are the one that I'm going to use, I would select it. And then any of these interventions that I'm going to use, I can choose them. These can all be edited within the care plan itself, but I just wanted you to have some insight into that initial care plan that is populating. So some things will pull in here for you if they are listed in another part of the database. So you'll find that they oftentimes will have a refresh button, meaning that I want to make sure that's the most current answer. Of course, if it's admission, it would be by default. And again, another care plan that we can add, and you can add as many as are appropriate. We're in vision. Maybe we want to make sure the person wears their glasses all the time. You've got mood, you've got dental status, and so forth, nutrition, and it's just going through all of those bodily systems. Again, within a lot of cases, a care plan possibly triggering after you sign and lock the document. This one here for skin, the temperature, the turgor, the pulse rhythm, peripheral pulses, providing if they're all normal and strong, or maybe some weak, chest pain at this time. The next thing it's asking for here, and why you see the people, is because it's asking for edema. So in order to add that here, the numbers on the body are trying to indicate to you a location. So if I had bilateral lower extremity edema, I would be looking at 41 and 42, or even lower if I needed to. When I open up site, the sites are going to be listed by number. Okay. So I can put the left lower leg, I can go back down to those 40s, and the right lower leg, you have the ability over here to type in additional information about it. I mean, maybe they're weeping or something to that effect. You also have below it some information or reference. All right, so you can have certainly more than one goal if applicable, and enter in anything that you need to have triggered into the care plan. The items here, you'll notice, have triggered for me already. Reason they did is because I populated the care profile in the header of the person's chart. So with that having been the case, if there was something more that I found as we came along, maybe somebody brought in a CPAP for the person, or you could find out a little bit later, maybe the son brings in a walker or a manual wheelchair, something like that, that maybe they used at home. When you're done, if you select save, sign, lock, and exit, this is just me saving it with a different button, you're going to get any errors within it are going to pop up for you. Now you saw that pop up and it's actually still there. It's right here. But I wanted to show you that at the top, it will tell you also here that there are errors. Anything red, light red, that kind of pinkish color, it's indicating something that you need to look at, whether it's missing documentation, whether it's just something you haven't seen yet. Just have that in mind. So I left a lot of the items in this assessment undone. There are 5 here where the response is required. So if I click on the error, which is going to be the section of ADM, and we're going to look at character H. So when I click on that, here's that section. Here's that character that is missing a required documentation. As I click on it, nothing really moved here because this was already there. But if you'll notice that little square around it, You're going to notice something different here. Now I'm going to go to the next one. It's taken me now down to the section that it wants me to address. And so as I go through, maybe I want to address the entire section. Doesn't mean I have to, but in the GI section, letter C does require an answer. So continent or incontinent related to bowels. Okay. You, of course, can add anything else that you might have missed, but what it was providing me with was the required missing information. Now, I can certainly continue to go through, going down to whether or not this person is continent of bladder, if they have a catheter, additional details, and then, of course, care plan if you want it. I could also, at this point, hit save, sign, lock, and exit again. And if I didn't quite finish them, it will show me. It's already taken me down to the respiratory section. And I can see under the error here that J1, tobacco, is requiring an answer. So we simply put it in there. You can still do the same thing as I could go back up and look at my errors, or I could just come in here and select the area to find out what the last one is. We're in vision, and it's giving us a little box around what it wants us to answer, which is A1. Once you're completely done with your assessment, you will have triggered care plans, initial care plans. What you're signing for here is the acknowledgement of the care plans. And I can now attest to those. It is now creating for us the care plan, the initial. Obviously, anything can be changed. Here, I'm attesting to the information I put in the assessment itself. I'm kind of signing off on the assessment. And now we have a complete assessment. If we were to go over to the care plan tab of the chart, you will see that today I created a care plan. If I select edit, which is what opens it up for me, everything that I indicated I wanted to have a care plan, you'll see the focuses, the goals, and the interventions that I checked. And so just kind of giving you a little bit of information there. It's not to say that we couldn't add something new, because who knows down the road, I mean, things change. So just wanting to make sure that you have that understanding, along with the fact that you have edit and progress note buttons. In here, you can start new interventions, new tasks, new goals, all of that kind of stuff. So you still can edit it, but it definitely gets this taken care of right on admin. Okay. Now, under the tab,
I have a question about that.
go right ahead.
So if they don't finish the whole thing, can they just save and exit and then they can get back in?
Yeah.
Because sometimes they won't finish it, so they shouldn't sign it.
Right.
So,
Yep. Whenever you are working on an assessment and you, let's say, have done part of it, but not all of it, you go to the bottom and you will find down there that we have the option of just save and exit. And when I do that, I have the edit button the assessment stays in progress until I complete it, sign it, and of course, lock it. If for any reason I initiated this on error, that could easily happen. The close button will allow this to just be incomplete and go into a closed status, not being completed, but that would only be if it were an error. Come back in later, select edit, and finish the document. And then you can sign it and lock it. So you bet.
When you were inside one of the evaluations, there was something called trig and then the letter H. What do each of those mean?
So the trigger is going to be, and it's related to care plans. So triggers are going to be items that will trigger an option inside the care plan. I'm going to go to the Braden because I suspect there's a few here. So even though this one is done, you're going to find that it has triggered some care plan options. Also, if for any reason they get erased, I can come back in here and regenerate them, and I'll show you in a moment. The H we call H-Link. It's another icon. You're going to see that throughout the software. Stands for history. If this question has been answered more than one time, when you click on it, you will see the previous answers to that individual question. Okay, now I'm going to cancel out of this. I'm going to go back into the care plan and show you that in the admission assessment, we activated or started certain care plans. However, at the same time, the other assessments, you'll hear them called evaluations, user-defined assessments, UDAs, forms, all meaning the same thing. They can trigger possible care plan items if somebody wanted to, maybe add it. These are all optional adds. So they come from progress notes, possibly, assessments or evaluations from the MDS. Those are the three places that you can get triggered care plans. You'll have a blue link at the top. And when I click on that blue link, I can see that I've triggered a possible care plan for impaired skin. I can hover over UDA, standing for User Defined Assessment, meaning evaluation. It will tell me the date it was completed and what assessment is triggering this. So what these are up here are optional care plans. If somebody did want to add it, they would place a check mark on whatever pieces of this they wanted added, and then hit save. It will leave this area and go into the active care plan. And let's see, so it's probably on my next page here. Let's see. Oh, I thought I didn't see it on the first one, but maybe I just didn't scroll down. Another thing to know, here's the skin integrity one I just brought in. It's here. Of course, it can be edited to suit the individual. Once everybody who might contribute to the care plan is done, somebody should go back in and delete anything that is left over, because next quarter or next time an assessment is due, or an MDS or progress notes, they are going to trigger new items in here. Okay, so just wanting to keep that information there fresh. Definitely consider removing all of them or clearing them. Select all, remove all. It's going to get rid of them. That's what I want. And now I have none. So at the end of each care plan time frame, when everybody that contributes to the care plan gets what they want out of there, someone should go back and remove anything left in there that was irrelevant for this particular care plan review. The H-link, like I said, you're going to see this all over the place. You're going to be able to see who entered it. And so there isn't any history really for this, except that I am the person who originally created the care plan. So if that's any kind of question, or if you need information on that, the H-link. Now, every quarter, if somebody comes in, or however often you review it and makes changes to it, then we're going to have people listed in the item changes. That my name would still be here as the person who initiated it, but so would anybody who's changes it over the course of time. Does that help a little bit?
Yes, thank you.
Oh, you bet. You bet. Questions on anything else? We do want to touch on tasks. As far as organizationally, are you going to have tasks automatically trigger for your communities?
And this is for the point of care, correct?
Yes, ma'am. Mm-hmm.
Lori, do you want things to automatically be triggered to the CNAs, or do you want to pick what you get to trigger?
It has to be based on what we do. I'm just looking down this list. So you mean that if they have to do their ADL flow sheet, it will trigger them somehow?
Mm-hmm. Yes, ma'am.
Oh,
So what it does, and what the training database is set up to do right now, are any kind of tasks that we would likely record information on for every resident. It is set up to, when we do that active admission, just like we triggered evaluations, which we're not going to do in the live database I'm hearing now, it can auto trigger the tasks that would apply to everybody. You certainly can and should apply additional ones that don't apply to everybody. A very good example of that could be catheter. That wouldn't trigger for everyone because not everyone would have it. Or if I was going to use a chair cushion or anything else that is down here not already added that I would like to have added and have documentation on. Everything listed here is what populates point of care for documentation. You'll notice on the right-hand side, there are two columns here, position and frequency. Under position is when people go to point of care, they list the position they want to see tasks for. Generally, it's going to be CNAs, unless you use it for other things like activities. The one thing that you will likely do is make sure that the frequency they're going to show up asking for documentation is correct. For example, bathing. So it's not going to be only scheduled as needed, because that's PRN, right? And our people probably aren't going to be placed on a bath schedule. So we would go into this, select edit, and as we scroll down, you'll find frequency. The frequency that you see inside here, along with this position, are identified on the outside of this under those columns. If I'm fine with the CNA being the person listed, but I would like to put them on a schedule, I utilize my search icon, which is the magnifying glass. And for people who are going to have something done certain days of the week, certain shifts, that's called weekly variable. When I change as needed or as necessary to weekly variable, down at the bottom, it is by default giving me a schedule to edit. And for Mr. Malone, maybe he told me he prefers his bathing in the morning. And what I have available for the time is, let's say, Monday and Thursday. Hit save and close. Save this particular document. And now when you look under frequency, it is labeled as weekly variable. It will only show up for documentation to be done for sure on the day shift on the days I selected. PRN will stay there because who knows, somebody could need a bath at any time and you may wish to have documentation on it, and so you could. PRN tasks are not required documentation. Anything that is a Q shift or scheduled at a specific time does require point of care, ADL documentation, and all of that is going to be done under clinical and in a tab that says POC. Any other questions? This will be something you guys can kind of think about. We're going to cover this again. And so we definitely, it'll be on the 12th. I'm going to talk about this again, but I definitely would like to kind of spark your internal conversation so that you can come in here to the training database. You can look at this. You can, make decisions. I highly recommend everybody come into the training database, add a new person, walk through what you've been trained now to do to make sure that you are, not having any problems with anything. Please don't use Mr. Malone. I'm using him for training, but go ahead and create your own person. See if we're able to apply what we've learned today. Our next session together is on the 12th, so you've got a bit of time. It's at 1 o'clock Eastern time. We're going to go over point of care and we're going to touch on tasks again. Any questions? All right. Any comments? Anybody have anything that you'd like to share before we conclude today?
Have a good day. No, thank you. All set.